Thank you for joining us today on the program Healthy Living. Amadesuwa Usa Uwagie. There is a huge social problem that is being suffered by both male and female. And sometimes, it becomes a thing of shame. People don't want to talk about it. Other times, it becomes something to stigmatize somebody about. And this is not usually a pleasant thing for some persons who are suffering from what we're going to be talking about today. Other times it becomes a subject for quarrel, a subject for divorce, a subject for separation, and something that would make people do what they ordinarily would not want to do. And what are we talking about today? We're looking at infertility. We've talked so much about infertility in women, and once the issue of infertility comes up, it is usually the woman's problem. It is usually the woman who is at fault. It is usually the woman who is infertile. People hardly look towards the man's side. But in recent times,
infidelity.
Yes, they see it as infidelity too. That's what is making the woman not to get pregnant.
Infertility.
But today we want to look at infertility in men, causes, symptoms, treatment, when to see a doctor, and of course what you need to do if there are other alternatives to help you impregnate your wife or your woman, as the case may be. So she's here again after a very long time. Join me as I make welcome our super duper embryologist, Dr. Tunika Akunyuli, the CMD of Tuni Cleo Fertility Center in Abuja, and of course now in Asaba. And that's a good news for those of us who live around that area. Happy to have you join us today.
Thank you.
It's been a while.
Yes, I miss being here. And I'm happy this is a Christmas time that we all need to enjoy ourselves and understand each other more.
And you're looking very Christmas too.
Oh yes, so this is my color. Thank you.
All right, infertility in men. If we're looking at infertility in men, what should we be looking at? What is infertility in men? What are the signs? What are the symptoms? So it's a double-decker question, and so that people can quickly start calling in. The number is going to appear on your screen shortly.
Good. Infertility in men, it's some questions that some people or some men wouldn't want to really dive into. When you define infertility in men, it's low sperm production, abnormal sperm cells, and then ejaculates that are small in volumes, and antibodies that actually attack sperm cells. It can be caused by psychological effects. You have endocrine disorder, hormonal imbalance, obesity, food that you eat, behavioral lifestyle, then a lot of heat on your scrotum that's exposed to a lot of high temperature can also reduce low sperm production or motility. We also talk about men that are working in forms of radiation places that are toxic to them, and they don't know that this is affecting them. When we talk about male infertility, you go as far as normospermia. That is a count which is more than 20 million according to World Health Organization. Anything less than that, we'll say that is oligospermia.
Okay.
When you talk about oligospermia, you're talking about a scanty count, almost like 1 million to 2 million sperm cells that you see, which is not, okay, about 1 to 2 million cells that you see. Sometimes out of 13 to 100 people that have low sperm count, usually don't fertilize a woman that is really fertile, even if she's so young. Some maybe, but it is very high that a low sperm count with low motility is a case, which we call astenospermia. Astenospermia means motility when how progressive or active the sperm cells are when we are talking about assisted reproductive technology.
Yes.
Good. And there's also what we call teratospermia. Teratospermia also is the form, the morphology of the sperm, the size of the head, the neck, and the tail. You have to look into it because this makes up the genetics of a man. And if this is not complete, a sperm that can fertilize an egg, let's say immature sperm cells, spermatids, are successfully to fertilize a good egg, may result to an abnormal child.
That's serious. Okay, now, you know, often a time when you tell men to go to hospital, they will tell you that, no, I'm fertile, we don't have it in our family, this, that, that. They tell you all sorts of stories for them not to go to the hospital. Now, how is a man going to know that he is not fertile enough to impregnate a woman?
Yes, a man that feels that he hasn't actually impregnated a woman for a long time. We see people like that. They come to you like they've had unprotected sex. If you know you have a good count, just like a woman, she feels that, oh, I think I'm ovulating, but I'm meeting with this man, I'm not getting pregnant. She quickly goes to go and evaluate. That's the African mentality anyway. But for the men, they just feel that
it's the woman's problem.
Yeah, that is the woman's problem. But it's also your problem. When we think a man is fertile, although researchers are still going on, it's starting now between 30 to 35 years. It's also declining in men. It's not like we're not saying an old man cannot pregnate a woman, but it depends on the motility and the type of climate change and behavioral lifestyle that we have.
Okay.
Now, a woman or a man that has a low sperm count and the motility is very good, yes, the woman can get pregnant. But we have more of them, about 90% of them, having severe oligospermia that cannot fertilize an egg. And this results to infertility, even when it's unprotected sex.
So a man sees himself ejaculate all the time.
Yes.
And he does not see anything wrong with that. How will he check his sperm by himself before going to the hospital? If at all he would like to go to the hospital.
Yes, if a man has tried himself and and he sees that something goes wrong and he doesn't want to discuss it with his partner, you will know from the volume of the sperm cells, of the semen cells, the seminal fluid. The volume that is being ejaculated is a problem. There's something we also call retrograde ejaculation, whereby a man is supposed to have orgasm and ejaculate, but it goes back into the bladder. It is very difficult.
So nothing comes out?
No, nothing comes out. It comes out in the form of urine.
And the man will not know?
The man will know that this is a problem.
Okay.
Yes, he knows. So if you have a low sperm volume, know that there's difficulty in ejaculating. You know that you are not very fertile. Yes. A man having retrograde ejaculation, when you know that, yes, is a very dry orgasm. That's what we call it. Orgasm, when a man and a woman meet, but you see that you are trying as much as possible not to expel, or let me say, come out with the seminal fluid. It becomes a little bit difficult for him. He quickly runs to the toilet as if he wants to urinate. We in assisted reproductive technology, once we get to know that from the history of the patient, we tell the patient to actually urinate in a sterile container, where it's not done in general labs, unless if you are really specialized in andrology. Andrologists are people that specialize in semen analysis when it comes to in vitro fertilization.
So it's not every doctor that will do this?
No, it's not every doctor that will do this. You have to take time to actually look into this with a urologist, nephrologist, and andrologist to actually really define if a man is has a normal sperm count, a low sperm count, motility is good, and a zero count. There are people that, yes, they produce seminal fluid, but there are no sperm cells inside. You have to go for evaluation. If you have tried a number of times unprotected sex with your wife and pregnancy has not occurred, go for investigation. If the lab tells you, okay, there are no sperm cells, they cannot just tag you that you are already exospermic. There are different types of being, before we tag you that you are exospermic. In vitro fertilization, once an andrologist is working, I talked about retrograde. We work with the urine. We wash it out, use the media, and then we look under a microscope. You will be lucky that you get a lot of sperm cells. Yes, from it, because there's a blockage. There are the passage that which is supposed to come out is going through another way. And a man that has a normal, let's say, volume, maybe up to like 6.7 mils or 5 mils or 2 mils, and there are no sperm cells. You can tell yourself, yes, I have a lot of ejaculates. I don't know why this lady is not getting pregnant. You go and check yourself too. Because this African mentality that the norm is for the woman, you need to check yourself. Because very minute of that volume that we have actually will show to us that either you are really azoospermic. When I say azo, zero. But before we tag you zero, like I said, we will analyze the sperm cells, use the media actually that mimics what is inside the man's system that controls it, and then we look under the microscope. If you see any live sperm, oh God, then we call it cryptozoospermia. What do you now do? You go for treatment. We tell you to, we put you on medications if you have to be on medications. There are also hormonal imbalances also. You do their blood test. Once you check it and they need some medication, we also give them. Okay. When you talk about IVF, you know, we are always talking about stimulating a woman, collecting eggs. Some of these men take more of this medication to boost their sperm. Yes, they take it. Just imagine a man also taking an injection. So it's a shame. It's a shame, and even when he comes around to do it, his ego is like, you know, trying to meet a nurse that's going to treat him. It's like a shame to him. That's why you're supposed to have nurses that are trained in vitro fertilization to actually calm a man down, you know, to have good patients, and, you know, you talk calmly to the man, then you give them injectables for some time. Then after like 2 months or more, you check again. You cannot decide at a point that a man that's a general lab has already said he's azoospermic. Already it's not. You will see that it is cryptozoospermic. Now what do? We don't do the normal conventional IVF. We have to do what we call intrastatic plasmid sperm injection, which is called ICSI. What does this do? It's a manual manipulation machine where you have to take a sperm cell, a single sperm cell on the screen that has a good overhead, a good neck and a tail. You suck it in and take the egg. You force invasive, that is a forceful fertilization that naturally the sperm cells cannot do. Yes, and then fertilization continues where we have to incubate. And you see that man, if he's so lucky, one touch, fertilization has gone on and embryos are good, and you transfer back into the woman, that man is satisfied. And if he ends up with twins or more, congratulations to him.
This is very interesting. At this point, I do not wish to ask plenty questions today. I want to leave the lines open for you who is suffering from one condition or two or three or four of what the doctor have talked about today, to put a call across to Dr. Tunika so that you get your answer. Not be teen of shame. Let me come down home. Not be teen of shame, okay? You want to make yourself happy, all right? And you want to make your wife happy too. So put a call across, and maybe you have somebody who is suffering from this. You can help that person too. They may not have light. We live in Nigeria. We know what's happening when it comes to power outage and all of that. They may not have power to watch this program. So all you need to do is put a call across to us. The number will be right there on your screen. 052-290573 is the number. We're doing early calls today so that a lot of persons can call into the program and ask questions. All right, it's better you do that now other than calling me later to say that the doctor is here now. Give her a call yourself, okay? And when you're calling, please reduce the audio level on your television set or move away completely from where your TV is. Ask your question, drop your phone, and then you can now turn on the volume on your TV to hear the doctor's answer. If you are not satisfied, you call again. All right, 052-290573 is the number on your screen right away. Do the calling now, and I'm sure, you know, early Christmas gift for your wife and for those around you is in order. All right, so do that call now. While we're waiting for calls, you did talk about lifestyle, and you and I know that the lifestyle these days of a lot of young men is not something to write home about, particularly when we have a lot of sports drinks around. Yes. There's this popular one now that everybody is crazy about. Yes, I don't want to mention the name right here, but every young man you see, married or unmarried, is carrying a short bottle of that sport drink, and some will even mix. Does this have effect on fertility?
A lot. In fact, drugs, alcohol, smoking affects a normal sperm count if you're not so careful. Like I said earlier, we used to say that at 30, 35, we're fertile. Yeah, I can impregnate anybody. Times have changed. Andropause is also clocking on men, just the way menopause is caused on women.
On women, okay.
It's on, no more, because the behavioral lifestyle of people now is really bad. Now, I was talking about exposing your scrotum to heat, temperature.
Okay.
Laptop, tight boxers, then
that's carrying your laptop on your lap.
On your lap.
Because it's a laptop.
Yes, yes. Because high temperature also affects this. That's where from the testicles where the sperm cells are produced. You may have a lot of immature sperm cells. You wouldn't know, but you just feel that you are taking this. A lot of people are taking different alcohol, super this, something man, I don't know. It's not so good for all of you. There are so many, and you are destroying your future. You may be enjoying this now, but I tell you that in the future, you are going to pay for it. Illicit drugs is wrong. Stop. This is part of what causes low sperm count, even low motility, even if the count is there. And even if the count is also there, fertilization will not take place. And if your wife is, her tubes are good, she ovulates every month, she still can't get pregnant. These are some of the causes.
That's a very,
also, you know, yes, that's one. And also infections, HIV, chlamydia, mumps, undescended, the testicles, they are all there. Some people are born like that. Already there is a genetic makeup that is coming up from there.
Okay, I was doing a little bit of research and I saw that small testicles or swelling in the scrotum is another factor for infertility in men.
Yes,
How true?
It's a genetic disorder because it's also been transmitted from the particular type of sperm. You see, when you have a sperm cell, you know, you analyze. All sperm cells you see, depending on abnormal sperm cell, you have like up to 100 to 100%. You can say normal sperm cells 60%, abnormal sperm cells 60%. If you're having abnormal sperm cells and analysis, you have up to 70%. There's a tendency that there's going to be a genetic abnormality transferred when it is being if it's that sperm that fertilizes the egg. That child, if you're lucky, may pass through 3 months, 4 months. If you have a miscarriage, you have to check. When a woman has miscarriages, we shouldn't just look at it's a woman's fault. You also have to go check the man also to be sure that the genetics, there's no genetic effect from him or any genetic effect from the woman's oocytes also.
Okay, I'll ask another question after this call. Hello, caller. Good afternoon. Hello. I actually thought somebody was on the line a while ago. Okay, hello. Please reduce the audio level on your television set, please. Good afternoon. Please tell us your name. Okay, Moses from Benin. All right, go ahead with your question.
I want to ask the doctor if spermatozoa is somehow like, can it impregnate a woman or can it fertile eggs?
If the sperm is how?
If the spermatozoa is light.
If it's light.
It's not pink.
Okay. If you can pregnate a woman, if the sperm is light.
Okay.
Okay, Dr. Seneca.
When a man produces, the sperm cells is usually very viscous. From that viscosity, we check, you know, the smell, if it's opalescent, if it's clear, it doesn't have any offensive odor, and then it liquefies. Some watery sperm, if the count there is good, it can swim very fast towards the time the woman ovulates.
Okay.
But if the sperm count, if you don't know at all, that it is watery, yes, some are really watery. When it comes to fertilization, I will tell you it's about 30% successful.
30?
Yes, naturally. But with IVF, or let me say conventional IVF, or ICSI, the intrastatic plasmid sperm injection, we will be able to do that, to help you to do the fertilization. That is why it's called assisted conception.
So should he be worried?
No, you shouldn't be worried. But if he has not gone to do any analysis, we have to be sure, because even a small ejaculate has a lot of problem. A small volume, there's difficulty in the sperm cells, even if it's present, to penetrate the eggs for any form of fertilization.
Oh. Okay, so brother, please go do something fast about that. The number is on your screen, 052-290573. Please call and let us know what can be done for you. Okay, with all of these problems that you have talked about, doctor, now what is the way forward for men who are suffering from all of this? What can be done to assist them?
When a man knows that he has undisturbed scrotum, he has to visit like a urologist or nephrologist. It is better you go see a doctor. A urologist best.
Okay,
but if you
let me just pause you a bit now. Before you'll continue after this. Hello, caller. Good afternoon.
Hello, good afternoon, ma'am.
Okay, good afternoon, madam. What's your name, please?
Mrs. Ima. No,
Okay, Mrs. Where are you calling from?
I'm calling from Benin.
Go ahead with your question.
My question is about what is the cause of poor erection and what is the cure?
Poor erection and the cure for it.
And what is the cause of poor erection and the cure for it?
Okay, when you say poor erection, please describe the situation so that doctor will know.
She's trying to talk about...
Yes, when you talk about poor erection, is it that, you know, there are different, from what I read, yes.
When a man is aroused.
Is it that the man cannot hold erection or what?
You have come to the doctor.
Okay, let's just give an answer.
Yes,
it's like
there are people that have erectile dysfunction, which is caused by diabetes, hypertension, endocrine disorder. It is not the man's fault.
Okay.
Yes. From youth, you see, I would say in Africa, we're not used to general checkup. We just feel that we are okay.
Well,
if
good.
a man, yes, if you cannot, if your wife needs to help you to make you feel strong, let me use the word. But if it's not coming on for a while, please visit a neurologist or a nephrologist.
Okay, what if the man is not diabetic, is not hypertensive, he does not have any ailment, but yet he cannot, you know, like...
have full erection.
That kind of
thing.
thing.
There are also management.
Okay.
Yes. We will not say that a man's low sperm count, immature sperm cells, or erection, sometimes they just have to. The woman needs to work if she knows that she doesn't have any child. You know, there are some people, they finish having children, and these men, they can, you know, secretly take some drugs. Maybe they were taking hard drugs when they were young.
Okay.
Yes. And at the point they stopped. By the time they decide to now settle down, you'll see that erection becomes a problem. That erection problem, like I say, if the woman cannot do it, they need to visit a hospital.
Okay.
Yes.
Okay, now, you know, in recent times, we have men taking some substance. I don't want to call names now. It's a very popular one. You see all these malam selling at filling station. They buy from medicine stores and all of that. Is very common amongst men. Sometimes you find out that some even die somehow along the line. We've heard of somebody who died in a hotel after allegedly using that kind of a drug. What's the effect of such sex enhancement drugs on fertility?
They are hormonal drugs. There are some we call like Viagra.
We're not supposed to call them, please. Just go ahead with it.
There are medications that we give. Sometimes there's tension. Okay. When a man wants to meet a woman, there's tension and he cannot produce. Especially in our field, when they just see that their wife is already, we've done like egg collection, and they see the state of the woman, for them to have an erection, the tension has gone in. And he can't just produce. We tell them, sir, you just relax. We'll give you about 2 to 3 hours for you to go home, then take some time. We will be praying, because if it gets to more than 18 hours of the egg collection, yes, we have to. Yeah, because a woman that is passing through injectables every day, only for us to start fertilization, and the man has tension and he cannot produce, it's so painful. We see it, and sometimes most of these oocytes, that's the eggs, they are all wasted. Yes, tension alone, women shouldn't also add any problem to them when they are passing through this.
Yes.
Please, you have to take this into cognizance that both of you are in partnership together in this business. Because when it comes to fertility, they are looking at you, they're looking at the woman. But one thing I want to also say is this: when we talk about gatherings of people, you know, women, They say, oh, if you know you are not you are looking for the fruit of the womb, can you come out? It's the husband and wife they're supposed to come out.
Not just
the woman. Because you don't know if the woman is the one covering the man. If you want to pray for them, both of them should come out. All of us should have the shame and have the stigmatization.
Okay.
Yeah.
Fantastic. 0522905573 is the number. Do give us a call and let's see what can be done for you. Hello, caller. Good afternoon. Good afternoon. Please, who are we speaking with? Okay, happy to hear from you. Please go ahead with your question and be audible, please.
Okay, I said, what is the cause of loss of appetite when a woman is pregnant?
Now I can't hear you. Hello, can you start again, please?
Okay. I said, please, what is the cause of loss of appetite in a woman who is pregnant and she hardly has days of food?
Now I'm finding it difficult to understand you. See, let's do it slowly now. What is worth of a woman who is pregnant? I didn't get that first part.
Okay, the loss of appetite.
The length of appetite?
Yes.
I don't understand.
Like you don't have appetite to eat.
You don't have appetite for food or for sex?
Yes, for food.
For food?
And yes, and she loves the taste of food. She's getting emaciated every day.
Okay, a pregnant woman not having appetite for food. I'm just getting you now. And you are pregnant, and she's emaciating.
Yes.
You should quickly go and see your doctor.
Your obstetrician.
Okay.
Quickly go and do that. Okay.
Thank you so much.
All right, you're welcome. I got confused halfway there. All right, 0522905573 is the number. It's right there on your screen. Give doctor a call because you and I know that she's not in Benin. She's visiting, and then we don't know where we're going to catch her again like this. So 0522905573 is the number. Yeah, okay, Asaba is close, really. Hello, caller. Good afternoon. Please tell us your name and ask your question, sir. All right, Wisdom, go ahead with your question.
I wanted to know what is responsible for this fact. When the man is trying to ejaculate and he discovers that the whole ejaculation is not coming out, so some are returning back to that, back to the system. So
back to the man.
Yes, back to the man. Instead of releasing everything. So what is the cause of that?
Okay, he wants to know the cause of that.
Yes,
you're ejaculating, it's not coming out fully, it's going back. What is the cause of that and possible treatment?
That is endocrine disorder. Okay. Working with hormonal imbalance, the pituitary gland and the hypothalamus. He needs to do some hormonal test, and as a blood test. And once this is detected, we'll know exactly what to give to him. Okay. Yes, either injectables or medications. There are medications for it. Okay. So people use alternative means to cure to cure most of this. Some use assisted conception to do it as fast as they can. Now, for others, they will go for alternative means. But you have to be careful with alternative means that you're using. If it's the traditional way, you have to be sure the measurement is good for you. Okay. The more you take more of it, it's going to destroy you more. Now, you see, I talked about the retrograde ejaculation. Yes. That it is a fault from the production from the semen. Okay. Yes. Instead of it to come out through, straight through the man's organ, it goes straight back into the scrotum. Okay, what could be the cause of that, and then the effect of it going back? The effect of it going back is that there's something we call like varicocele, like enlarged veins, which some people have to go open. You do the cells, you have to remove, and then you do analysis on that. Okay. In IVF, we go straight into the testes to go help the man
So,
in case, yes, to remove sperm cells.
But this one that wants to do it by himself.
He wants to do it by himself.
Yes.
Medications is what he needs.
Medication is what
yes,
he needs.
Investigation, then medication. That management is not a total cure.
Okay.
It may take a while, but there is management.
Okay, this issue of it going back, would it not be cancerous to the man? Is it not going to cause any problem to that man?
Well, it depends on how long the person has been on it, because so many men don't come out to actually say their problems. Okay. And we are here, or I'm here, to let you know that don't look at women all the time. Check yourself. Come out. There's no stigmatization. The earlier you do it, the better, because the older you do, men are also going into andropause. Don't say a woman is going into andropause. Men are also going into andropause. You see? But once you see your ejaculate starts very minute, very small, or the volume is too much, or is sticky, we call it antibodies that are attacking the sperm cells. Okay. Once they attack the sperm cells, they can't lose up. By the time they want to lose up, most of the sperm cells will die. Okay. And they cannot be able to swim through the tubes to go and fertilize any eggs that is coming.
So what's your immediate advice for this young man who just called?
Yes, I think he needs further evaluation.
Okay.
Yeah, so once he does that, then we'll know management
so
to give.
What doctor is he going to see?
A urologist or an nephrologist.
Okay, okay. I hope you got that right, okay? 0522905573. I decided to open the lines early so that you can ask all the questions you want to ask. Hello, caller. Hello? Please, when you're calling, reduce the audio level on your television set. Otherwise, doctor will not hear you. Hello? Hello, caller. Good afternoon. All right. We're still going to take more calls in a moment. Let's ask more questions. Now, you talked about the... Yes. Now, let's look at history of testicular prostates or sexual problems in a man. When a man has prostate cancer or his prostate is enlarged, can he father a child? What can he do?
Depending on when the PSA, we call it prostate test and antigen. When you, like I said, it's good for us to have medical checkup every time, not just women going through. From 35 years, every man has to check themselves, because the increase in us having prostate cancer is so high. Once a man gets to know that there is the presence of the antigen, he needs treatment, which is he's going to undergo chemotherapy. And if you know that you're not married, you've not fathered a child, what you need to do is for you to visit a very special laboratory that is into assisted conception, where you can have to produce your sperm cells, and we freeze it. Freeze it before you undergo your chemotherapy, because undergoing chemotherapy will destroy more of your sperm cells, even the motility or the count. Yes, that is what any man that has been diagnosed with the presence of an antigen in the prostate, that you have to quickly go for sperm freezing. But some people don't understand this, so you need knowledge.
Explain sperm freezing to us, so that those who don't understand it will now understand and know exactly what to do. Because we used to think prostate cancer is old men thing, but we're beginning to find it even in men as young as 28, 30, 26, 25.
Yes, biological clock, like I say, is clicking on everyone because of lifestyle, climate change, and the type of food that we eat. Some people take vitamin D. You can take zinc. Some people take do weight lifting. Not just walking. Yes, it can help with a good semen production.
Really?
Oh yeah, weight lifting, jogging is good. Yes, it's good. Even if you are taking some medication, we do this. It's not just ordinary exercise, jogging, weight lifting. Yes, it is very good for you. Now,
what about the men who do karate, martial arts and all of that? We need to know.
You may enjoy yourself.
So not that kind of sports.
No. We don't. I don't advise that, because with my wealth of experience, I don't think that as that part is necessary.
It's good enough.
Yes, it's good enough. Now, when we talk about sperm freezing, a man already knows he has a problem. What he needs to do is that he goes to an IVF center.
Okay.
where a sterile container is given to you. You go home. You can do it through coptus interruptus or ejaculation.
Okay.
Yes. You ejaculate or you put in the container and return it back within 40-45 minutes of semen production to the IVF center or a very good certified lab to actually check how your sperm count looks like, and then the active motility, progressive motility, and non-progressive motility. All these are meant to be spelled out. Then you have the abnormal sperm cells and the normal sperm cells. If abnormal sperm cells are taking about 70% to normal sperm cells to be 30%, you should already know that there's a question for that. But that isn't a challenge in vitro fertilization or assisted conception.
Okay.
What you need to do, we are the experts in it, in andrology. We take the sperm, there are media that is suitable to actually mimic the live sperm cells.
Okay.
Then we take it into a dewar where we have what we call liquid nitrogen, rating from -196 degrees.
Wow.
When nobody, in fact, it can burn your hands. You have to be careful with it. We freeze it, not freezer, not fridge.
Don't go and put your inside freezer.
Yes, and so if you want to keep that, it's not going to work.
Okay.
We call it cryopreservation.
Okay.
Both in women with ovarian cancer, men with prostate cancer, they are still wanting to, before they start chemotherapy. They do all, you can save your eggs, you can save your sperm cells as long as you want until your chemotherapy is through. And then you feel that, yes, you are okay. But it must be in an assisted reproductive center where this can be done. Please do not put it in your freezer.
So how long can you keep it? For exactly how long? How many years?
You can keep it as long as you can. If you can pay 10 years, 5 years.
You pay to keep it? Oh,
yes, because you really have to. We have to top the liquid nitrogen. Because usually, it's just like you having life. You know, your air.
You have to continually breathe in and
respiration and all. So whatever that's coming out, you see the liquid nitrogen also going down. What you need to do, you have to always top it. And the andrologists or whoever, there are systems that will tell you the liquid nitrogen is going down, and you have to make sure that it's being refilled. If you don't do that, most before the people come back to use it, it may get up to that. Most of the sperm cells are dead.
Oh my word!
Yes, you have to be in a really good center that can freeze your sperm cells.
That's fantastic. You keep topping the nitrogen to save the sperm.
Yes.
And then when it's time for use, it will come out good.
Oh, good. Wonderful. Once you are ready that you want to use your sperm cells, we bring it out from the dewar, we thaw them. When we say thaw, it's like defrosting. Okay. Yes, we wash the cryoprotectant out that protects this skeletal structure of the sperm cell. Once we do that, you see that the sperm cells go back, moving speedily, you know, so fast, even with the media that we use. Naturally, on its own, it's not doing that. Like those men with a low active motility. Once we use most of this, our media, to do this work, you see the movement of the sperm cell. Once the seminal fluid is removed, the debris are removed, and they were left with the platelets. Once you put it in a microscope, you will see how fast it is. But naturally, it's not, he is not able to do it. But with assisted reproductive technology, he is able to do it.
Now, after the first use, can you freeze it again?
No. We freeze them in different aliquots. Okay. Yes, I don't have to tell you every media that we use, that's what survives the sperm. Yes. It's different companies. So there are different volumes to volumes that you use. Okay. Some men produce up to like 2 mils, and if you see the count, a little drop is good for you. You can know the volume at which you can miss, where the cryoprotectant can actually hold the sperm cells before it is put inside the liquid nitrogen in a straw. Wow.
So if you take out a bottle, for example, yes, that one use, you can't use it again.
No, we can't use it. But so if the man, if the man has, like I say, let's say a very little count, we have to spread it up to like 3 aliquots. Okay. Yes. So at the time we want to use it, because a man's sperm cell, it's not like eggs. And like we women, you know, our own, they are counted. We have 8 this way, have 6 here, that's like 14 eggs. Even at the end, you had 10 or 4. But a man that has a good count and it's frozen, By the time you thaw it, that's you defrost, let me use that language, some of the sperm cells are dead. So compared to a man that has a very low sperm count, you have to tell the man that he needs to continue to produce, you know, like every other 2 or 3 days, so that we can have a lot of aliquots, especially with those that live within or live outside the country, or those that want to undergo any form of treatment.
Wow, that's interesting. 0522905573 is the number. But let's quickly take a very short break. And after this break, we'll be back to take all your calls. We have a few minutes left. So let's do that break now. Thank you for staying tuned to the program Healthy Living on Independent Television. Now, doctor, for a man who has been diagnosed, is gone to hospital, is now know that, oh, this man does not have sperm at all. Is there hope for such a man?
There is hope.
Okay, please tell us about it.
There is hope. Just the way we say that diabetes, hypertension, or any underlying ailments or genetical disorder is affecting a man's sperm cells or sperm count or sperm functions. Like I say, there's something we call obstructive azoospermia and non-obstructive azoospermia. That is where we enter TISA or PISA when we do assisted reproductive technology, testicular sperm aspiration. It is a tedious work for us to do, where a tissue of it is being removed from the scrotum through the testis, and then the tissue is what we use in the lab, and then we tease very well with the media to be sure that there are sperm cells in it, although you will see spermatids, spermatocytes, then spermatozoans, because there are different stages, even, you know, immature sperm cells, so the normal sperm cells, and the shape. You will see abnormal head. The shape of the head of a sperm, that is the sperm function. Yes. You know, depends again, because that is what we call about the full morphology of the sperm. If there's more abnormality with the head than leg, we call it teratospermia. Okay. This, as we get tissues and we see that most of these sperm cells are there, we wash just the way if we have urine already in a tube. That's we wash and remove. We remove those sperm tissue, blood, then we go for ICSI. Naturally, it won't work. Conventional IVF, it won't work. Wow. It has to be an ICSI. The higher form of in vitro fertilization is intrastatic sperm injection, especially for men that have low sperm count or those that we have been able to retrieve sperm from, because we want to be sure that is it obstructive azoospermia or non-obstructive. You see people that obstructive, yes, you'll get something from there. Yeah, because something went wrong, you know, through the vesicles for the sperm cells to come up, but it's not, it's returning back. So we go to the tubules and then we extract. Then before we tease and remove the sperm cells, you're lucky enough, your wife has a lot of eggs, we do the fertilization, we invade it ourselves. Yes. You help and do the fertilization for you. And it's not like we got your wife pregnant, but ART has come to stay. Yeah, to help you and to define you. Do not let any lab actually tag you that you're azoospermic. Until a full analysis is done. Because most of these people they call being azoospermic. Once I see someone is cryptozoospermic, oh my God, I know that there's hope for that man. Yes, because already the general lab on its own don't do this. Andrologists, which we have all learned, is that there are media that you use, and there are ways as we should remove the sperm cell before we tell you, say, yes, sir, the seminal fluid you produce is out. There's no sperm cell, there's no sperm cell. So, sir, you need the sperm donor. Okay. And that is it. Okay. Hello, caller. Good afternoon. Hello? I did hear a voice. Hello, good afternoon.
Your call has been placed on hold.
Okay, don't put the call on hold. 0522905573, and we have just a few minutes left, so give us a call. You know, I'm looking at you. And I'm wondering within myself, with the kind of patriarchal society that we live in, where everything is like a man's world. Okay, let's pick this call first before I ask that question. Hello, caller. Hello. Hello. Okay. And I'm just trying to imagine how comfortable a man will be sitting right in front of you and then listening to you, analyzing him.
Yes.
You know?
Yes.
So how do you make men comfortable to talk to you?
Good. Like I say, in this African setting, when a woman and a man live together, after like unprotected sex for a year, you know, even if you get married in 6 months, everybody expects you to be pregnant.
To be pregnant the next day.
Like as if it's magic. After 1 year, nothing. You see, it's good. Once it's 1 year, if you say you decided to enjoy yourself, that's good for you. But don't let it exceed more than that, because you don't know what the future holds for you. Quickly, 2 of you go for evaluation. That's investigation.
Okay, 2 of them, not the man alone.
Yes, but this African setting we have, the man will say, I've been impregnating women since I was young, so I don't understand what is wrong. You go to the hospital. Because we already have this natural thought that the woman is the problem. Yes, the woman is a norm.
Yes.
Yeah, and it's like a gender-based violence against women.
Against women.
That is emotional violence. It's betrayal. You cannot allow your wife to stay with you for like 20 years and she's going for investigations and you are not going. And at the end, 2 of you, let's say we are seated, we're doing our clacking, and we do your evaluation, we now say that you are the one in charge. I've seen people like that, they want to fight. You see the woman like, oh, you see, you kept me like 10 years and this is what is happening to me. You are the cause of this, but I'm going to, you know, you have to calm them down. Okay. You have to calm them down. If at the end of it all, the man really is for instance, is isospermic, they have to sit down to think. Okay. If they will need a donor sperm. Okay. Genetically, yes, he's not the provider, but biological, and he will become the biological and the reigning father. Okay. But please, do not just tag a woman that she's the cause of every problem. The men should also go and evaluate. When you see the man, you are telling him that he's the cause of the problem, all the ego and the power will just relax. Will just drop. If he has a good woman by the side, they will give him a pat. Don't worry, I think at this journey we can do it together. Okay. But if you don't understand each other so well, there's going to be a fight at home. Because she must have passed the peak at which she's supposed to be very fertile. But because she refused to go for evaluation, you've also affected her. So some people will decide, okay, let's go for adoption. Some people say, okay, since I love him, let's go for sperm donation. That is confidential between 2 of you. There are also issues that the men will come on their own. They wouldn't want their wife to know. What will I do? I want to save their marriage. Not me, but God. I want to save. Okay, we discuss. Well, there are consent forms, there are reasons why you have to do this. Then we go ahead. So it's possible for a man to come secretly. Yes, they do that. Ask for sperm donation. Yes, they do that. Without telling his wife. Oh yes, they do. They do that. They do that. And we send them to a counselor to actually know. Yeah, okay, yeah, you are really married. And then you don't want your wife to know. What are the reasons why you don't want your wife to know? You have to give us reasons. Then before we think we can back you up. But you will have to now come back again, invite your wife, and we say these options. That in case, we have to stimulate your mom, and then we have to try your husband's sperm is low, and we'll think of what to do. You may end up with using a donor egg, or you may end up with using a sperm donor. So whichever way, both of them now knows that this is going to be right with me, or is this going to be right with me. Most times, some people will even move out as they're living less in my office. Say, excuse me, use a donor sperm. Even though he says that, sir, you need to come because I need you to sign your consent form. Okay. Because without this, I cannot do that job. You cannot do that. Yes. So people just come, donate sperm and go? Oh, yes. There are people that can come, donate their sperm. That's people, they know that some men, their sperm counts are no good. Because a lot has been happening, alcoholism, drugs. I'm just wondering how you keep track. Hello, caller. I'll ask you that question again. Hello, good afternoon.
This medical doctor that is on the screen. He's very brilliant. I want to get the contact address.
Okay, you want a contact address. Okay. We will of course discharge our social responsibility to you in a moment, okay? So just stay tuned. At the end of the program, I will call out a number that you can use to do follow-up. I said just relax. I will send you a number that you're going to use to call us later. All right, thank you for commending my doctor. She's an award-winning doctor.
Oh, yes.
Okay, so moving on, and now as we're about to wrap up the program, you did talk about food. You did talk about food, and you also talked about heat.
Yes.
So talk to us more about this food. What kind of food will disturb a man from producing quality sperm? Or what kind of food will aid a man?
Okay, there are simple reasons that we think is so difficult, that we think is a storm. You will just see that, okay, in this section at which we have to be sure that we have vitamins in more of our food that we take, antioxidants. There are fruits, vegetables that you need to, even just like women.
Okay.
So it also pertains to men. As women have hormonal imbalance, that is the way some men have hormonal imbalance. Those that are, obese, you want to try to reduce your weight. Even same thing with the women. Okay. Because once you do that, ovulation can actually still take place in a woman. And a man that does a lot of exercise, like I was to say, we also have a higher count.
Higher count.
Yes. And some people would think about doing acupuncture, but we are not so certain. There's no significant result so much about it, but most women also do that, and then some men, they do it also.
Fantastic. All right, for that man who wants a number to do a follow-up with, and for others who didn't want to call in because of one reason or the other, now here's the number you can use to call immediately after the program, not when we're still on air. The number is 080-9690-2513. 080-9690-2513. That is the number to call us with, okay, immediately after the program. All right. Infertility in men is treatable.
Yes, and we'll continue.
Yes, it's treatable according to doctor, depending on the level. There is a solution. Okay, yes, and it can be managed according to Dr. Tonika of Tunicleo Fertility Center. She's in Abuja, she's also in Asaba and London. This is fantastic. Okay, so there is good news. Gone are those days where you suffer in silence.
Yes.
Please speak up. Okay, speak up, because the shame is usually that of the woman. All right, until the man marries a second woman or tries a third and fourth and discover that he cannot actually make babies. And when a woman says that you are desperate, she will bring a baby for you from anywhere. And then at the end of the day, you now cry foul when you do a DNA, particularly when you want to travel. When you pressurize the woman too much, she may just do the unthinkable. Particularly when there is no trust between you, when there is no love between you, and when you people do not communicate adequately. So see a doctor so that your problems will be solved. 080-9690-2513 is that number. And Christmas just came early for you, okay? Doctor, thank you very much for making it to our studios today amidst your tight schedule.
Thank you very much too. I hate the men. Don't be ashamed. There's no stigmatization. Just come out of your shell, talk to us, we can help you. It can be managed, okay? Even if it's not treatable, it can be managed. If it's too bad, assisted reproductive technology will take care of you. Thank you.
Bye-bye, and God bless you all.